8 shocking facts about how often older women should bathe after 70. You might think the answer is simple, just take a shower every day, right? But what if I told you that could actually be harming your skin, increasing your risk of infections, and even making you more likely to fall? As we age, our bodies change in ways we don't always expect. Our skin becomes thinner, our sweat glands slow down, and even our sense of smell might not be as sharp as it used to be. So, how often should you be bathing? The answer may surprise you. In this video, we'll reveal the 8 essential facts you must know about bathing after 70, why too much washing can be dangerous, how to stay fresh without daily showers, and simple ways to protect your skin and health. Stay with me until the end, because number 7 is something most people never think about, but it could save your life. Now, let's get started. As we age, our bodies go through changes that affect everything, from how we feel to how we take care of ourselves. Bathing is no exception. But did you know that the way you bathe in your 70s and beyond should be different from when you were younger? Let's break down 2 major reasons why. Fact 1: Skin becomes more fragile with age. As we get older, our skin produces less natural oil. This leads to dryness, itching, and even cracking. Our skin also becomes thinner, which makes it more sensitive to damage. Bathing too often, especially with hot water and harsh soaps, can strip away the remaining moisture and make things worse. This is why dermatologists recommend that older adults, especially women over 70, avoid daily showers unless absolutely necessary. Instead, bathing 2 to 3 times a week is often enough to stay clean without overdrying your skin. If you feel like you need to freshen up in between, a warm washcloth or sponge bath can do the trick. Plus, using a gentle, fragrance-free moisturizer right after bathing helps lock in hydration. Fact 2: Decreased sweat production means less odor. When you were younger, sweating was a big reason for frequent showers. But as we age, our sweat glands slow down. This means we don't produce as much sweat or body odor as we used to. So, unless you've been very active or exposed to dirt, you probably don't need to shower every day. Many older adults worry about body odor, but in reality, unless there's an underlying medical issue, a simple routine of washing key areas daily, like underarms, groin, and feet, will keep you fresh without needing a full-body shower. Your body doesn't require as much washing as before, and overdoing it can actually cause more harm than good. A balanced bathing routine will help keep your skin healthy and comfortable. Now that we understand how our bathing needs change with age, let's talk about something even more surprising: the hidden dangers of bathing too often. You won't believe what we uncover next. Now that we've talked about how aging affects bathing needs, let's discuss something even more surprising: why bathing too often can actually be harmful. Many people assume that showering every day is the best way to stay clean, but for women over 70, that's not always the case. In fact, overwashing can cause serious problems. Let's go over the top 2 hidden dangers you need to know. Fact 3: Frequent baths can increase infection risk. Your skin is your body's first line of defense against infections. But as we get older, our skin becomes thinner and loses moisture more easily. Bathing too often, especially with hot water and harsh soaps, can strip away protective oils and leave your skin vulnerable to bacteria and infections. One of the most common issues I see in older adults is dry, irritated skin that cracks and becomes a gateway for infections. Overwashing disrupts the skin's natural microbiome, the good bacteria that help protect you. This can lead to conditions like eczema, dermatitis, and even fungal infections in areas like the feet and underarms. So, what can you do? First, limit full-body showers to 2 or 3 times a week. Second, use lukewarm water instead of hot water, and switch to a mild, fragrance-free cleanser. And most importantly, always moisturize right after bathing to restore your skin's natural barrier. Try applying lotion while your skin is still damp; it helps lock in moisture more effectively. Fact 4: Hot showers can increase fall risks. Nothing feels better than a warm shower, right? But for older women, too much heat can actually be dangerous. Hot water can cause blood vessels to expand, leading to sudden drops in blood pressure. This can make you feel lightheaded, dizzy, and more likely to fall. Falls are one of the biggest health risks for older adults. A hot shower, combined with a slippery bathroom, can be a serious hazard. Many of my patients don't realize how quickly they can feel dizzy when stepping out of a steamy shower. So how can you stay safe? Here are 3 quick tips. Keep the water warm, not hot. Aim for a temperature between 95 degrees Fahrenheit and 100 degrees Fahrenheit, 35 to 38 degrees Celsius. Use a non-slip mat and grab bars. These simple additions can prevent accidents. Sit down if needed. A shower chair can provide extra stability and comfort. By making these small adjustments, you can reduce the risk of falls while still enjoying a relaxing bath. Now, if you're wondering what happens when you don't bathe enough, you might be surprised. Let's talk about the risks of not showering enough and how to stay fresh even when you skip a full bath. We've talked about how bathing too often can dry out your skin and even increase your risk of falls. But what happens if you don't bathe enough? Some people believe that since older adults sweat less, they don't need to bathe as often. While it's true that you don't need a full shower every day, skipping hygiene altogether can lead to some serious problems. Let's go over 2 important facts you need to know. Fact 5. Hygiene matters even if you don't sweat much. As we age, our bodies produce less sweat and oil, which means we might feel cleaner for longer. But that doesn't mean we are. Even if you're not sweating much, your skin still sheds dead cells every day. Without regular cleaning, these dead skin cells, along with natural bacteria, can build up, leading to itching, irritation, and even unpleasant body odor. One of the biggest misconceptions is that if you don't sweat, you don't need to wash regularly. But skin naturally produces bacteria and shed cells, which can lead to odor and irritation. If not washed away, this buildup can also clog pores and contribute to conditions like acne or rashes, even in older adults. The good news? You don't need a full-body shower every day to stay clean. Washing key areas, like your underarms, groin, feet, and face, daily with a damp washcloth or gentle cleanser is enough to keep you fresh and prevent irritation. Use a warm, damp washcloth with mild soap to gently clean these areas if you're skipping a full shower. It's quick, easy, and keeps you feeling fresh. Fact 6. Urinary and fecal bacteria can cause illness. This next point is something that isn't talked about enough, but it's incredibly important: personal hygiene after using the bathroom. As we age, we may not always realize how important proper cleaning is after urinating or having a bowel movement. But neglecting this can lead to bacterial buildup, infections, and even serious health complications. Older adults, especially women, are more prone to urinary tract infections, UTIs, and skin infections. If the genital area isn't cleaned properly, bacteria can multiply quickly, leading to discomfort, irritation, or more serious infections. So, how can you prevent these issues? Here are 3 simple but effective hygiene habits. Wash or wipe front to back. This prevents bacteria from spreading from the rectal area to the urinary tract. Use gentle, unscented wipes or a warm washcloth. Harsh soaps can cause irritation. Change undergarments daily. Wearing clean, breathable fabrics helps prevent infections. Taking these small steps can make a huge difference in preventing discomfort and keeping you healthy. Now that we've covered the dangers of bathing too often and the risks of not bathing enough, let's talk about the perfect balance. How can older women maintain good hygiene while protecting their skin and overall health? The key is following a safe and effective bathing routine that keeps you feeling fresh without overdrying your skin. Let's go over 2 essential facts to help you build the right routine. Fact 7. Washing key areas is more important than full showers. Many people think they need to take a full-body shower every day to stay clean. But the truth is, daily washing of certain key areas is more important than a full shower. These areas include your underarms, groin, feet, and face, where bacteria and odors tend to build up the fastest. For older adults, a full shower every 2 to 3 days is usually enough. However, daily cleansing of high-risk areas helps prevent skin irritation, infections, and odor. A quick sponge bath or using a warm washcloth can be just as effective as a shower. Here's a simple routine to follow. Morning refresh. Use a damp cloth or gentle cleansing wipes for your underarms, groin, and feet. Evening routine. Wash your face and hands with lukewarm water and a mild cleanser before bed. Full shower. Take a full-body shower or bath 2 to 3 times a week, depending on your skin type and activity level. If you struggle with mobility, try using a long-handled sponge or shower wipes designed for sensitive skin. Fact 8. Moisturizing and skin care is just as important. Taking a shower is only half the routine. What you do after your bath is just as important. As we age, our skin becomes drier, which can lead to itching and irritation. That's why moisturizing is essential to keeping your skin soft and healthy. Older adults should always apply a moisturizer immediately after bathing. Look for products that are fragrance-free and contain ingredients like ceramides, hyaluronic acid, or shea butter. These help lock in moisture and prevent dryness. Here's the best way to moisturize after bathing. Pat your skin dry instead of rubbing it. This prevents irritation. Apply lotion while your skin is still damp. This helps lock in moisture. Focus on dry-prone areas. Pay extra attention to your legs, arms, and hands. Keep a bottle of moisturizer next to your towel so you don't forget. By following these simple bathing and skincare habits, you can maintain cleanliness, comfort, and confidence without harming your skin. But before we wrap up, let's answer some common questions, like what to do if you have trouble bathing alone and the best products to use for sensitive skin. We've covered a lot of important information today, from how aging affects bathing needs to the right hygiene routine for older women. But I know you might still have some questions. In this final section, I'll answer some of the most frequently asked questions and share practical tips to make bathing easier and safer as you age. What if I have trouble bathing alone? If you struggle with balance, mobility, or just feel unsafe bathing alone, you're not alone. Many older adults face this challenge. Here are a few simple solutions that can help. For those with mobility concerns, investing in adaptive bathing equipment can make a world of difference. A sturdy shower chair, non-slip mats, and grab bars can greatly reduce the risk of falls. If you still find it difficult, consider having a trusted family member or professional caregiver assist you. There are also home health services that provide bathing assistance in a respectful and private manner. A handheld showerhead allows you to direct water exactly where you need it while staying seated, making the process much easier. What are the best soaps and shampoos for older skin? Not all soaps and shampoos are created equal, especially when it comes to aging skin. Many regular products contain harsh ingredients that can strip away natural oils and cause dryness. Instead, look for these gentle alternatives. Older adults should avoid heavily scented or antibacterial soaps, as they can be too harsh. Instead, choose moisturizing, fragrance-free body washes with ingredients like glycerin, aloe, or oatmeal. When it comes to shampoo, opt for sulfate-free formulas that won't dry out your scalp. And if you have very dry hair, washing just 1 to 2 times a week is often enough. Best choices include body wash, Dove Sensitive Skin, Cetaphil Gentle Cleanser, Aveeno Oatmeal Wash Shampoo, Shea Moisture Sulfate Free, Vanicream Free and Clear, Neutrogena Tea/Gel, for scalp health. Use a soft washcloth or a silicone body brush instead of a loofah. It's gentler on aging skin. What if I don't feel like bathing? We all have days when bathing feels like too much effort, especially if you're dealing with fatigue, arthritis, or pain. But staying fresh doesn't have to be difficult. Here are some simple alternatives. If you're not up for a full bath, using no-rinse body wipes or dry shampoo can help you feel refreshed without the effort of a full shower. Even just washing your face, underarms, and groin with a warm washcloth can help you feel clean and comfortable. Keep a pack of unscented cleansing wipes near your bedside for quick refreshes on days when showering feels too exhausting. How can I make my bathroom safer? Safety in the bathroom is so important, especially as we get older. Falls are one of the leading causes of injury for older adults, but they can be prevented with a few simple adjustments. Installing non-slip mats, grab bars, and a shower chair can significantly reduce the risk of falls. Good lighting is also key. Make sure your bathroom is well lit, even at night. A night light in the bathroom can make a big difference, especially for nighttime trips. Here are must-have safety items: non-slip mats, grab bars near the toilet and shower chair with backrest, handheld showerhead, motion-activated nightlight. If you live alone, consider a waterproof emergency alert button in case of a fall. We've covered a lot today, so let's do a quick recap. Bathing every day isn't necessary, but hygiene is still important. A balanced routine of full showers a few times a week, daily spot cleaning, and proper moisturizing will keep you feeling fresh and healthy. And remember, your safety matters. Simple adjustments like grab bars, a shower chair, and gentle skin care products can make all the difference. Now, I'd love to hear from you. What's your biggest struggle when it comes to bathing and hygiene? Leave a comment below, and don't forget to like, share, and subscribe for more tips on living your best life at any age.